Gentlemen, thank you as always for joining us for this COVID-19 update. Let me recognize the presence of the Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, the Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke, the Permanent Secretary in the Ministry of Tourism, International Transport and Maritime Initiatives, Lisa Valmond, National Epidemiologist Dr. Shaluddin Ahmed, Coordinator for the Reopening of Borders Program, Dr. Laura Esprit, Officer in charge of the Office of the Director of Primary Healthcare Services, Dr. Gilda Nesty, Senior Environmental Health Officer, Isabella John, and the Head of the Criminal Investigations Department, Superintendent Davidson Valerie. Let me also welcome our media partners and Dominicans here and in the diaspora. Let's begin first off with a status update from the National Epidemiologist, Dr. Shaluddin Ahmed.
Let me acknowledge the presence of Honorable Dr. Arvind McIntyre, Minister of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke, Permanent Secretary of Health, Ms. Lisa Valmond, Permanent Secretary of Ministry of Tourism, Dr. Gilda Nesty, Director from a Healthcare Acting, Dr. Laura Esprit, Coordinator for the Reopening of the Border Committee, Ms. Isabella John, Senior Environmental Health Officer, and Inspector Davidson Valerie. Good evening, everyone. We have now an additional confirmed case of COVID-19. The total number of COVID cases is now 19. The recent confirmed case is an imported case. He is a British national. He arrived in Dominica on August 10. Prior to arrival, he had 2 PCR done and which were negative. On arrival, the rapid test was conducted and it was negative as well. He was on home quarantine for the most part. Currently, he is asymptomatic and he has been asymptomatic all through his quarantine phase. He was admitted to the COVID center last night and he will be monitored for next 14 days at the COVID center. Contact tracing is ongoing and more details to come from one of our presenters. As it stands, total number of confirmed cases, 19. Total active cases, 1. Total recovered cases, 18. Total number of deaths, 0. Total number of PCR tests conducted so far as of today, 1,938. Total number of negative PCR results so far, 1,919. Total number of travelers came to Dominica since July 15 to July 20 today, roughly about 690 travelers. And of them, one is positive. I just want to touch briefly on protocol of coming in. So all visitors coming to Dominica are required to do the following prior to arrival. PCR testing should be done within 3 days from the arrival date, except citizens and residents of the following countries who had been residing in their respective countries for the past 21 days. The countries include Anguilla, Antigua and Barbuda, Barbados, British Virgin Islands, Cayman Islands, Grenada, Montserrat, St. Kitts and Nevis, St. Lucia, St. Vincent and Grenadines. These countries are part of the Dominica travel bubble based on the following criteria. 1, these countries do not have community or local transmission based on the latest report from WHO. And these countries have 0 local transmission in the past 7 days. Those who fit the criteria of Dominica travel bubble do not require PCR testing prior to arrival. On arrival, they will go through a primary screening process, meaning rapid test will be conducted at the airport. All travelers coming from the high-risk countries are required the following: to have a negative PCR results that taken, meaning swabbed or sample taken 72 hours prior to the travel date, and mandatory quarantine at the government quarantine facility or COVID-certified hotel or guest houses for 5 days on arrival. All travelers must submit online questionnaire and get screened. And once one is screened, approval or disapproval notification will be sent out. One must keep a copy of the PCR result and approval notification prior to the boarding, because these documents will be checked during embarkation, and on arrival must submit them to the port health officer. The health questionnaire can be accessed via official website, that is domcovid19.dominica.gov.dm. Lastly, I want to say to the public, the dreaded COVID is back. Let's keep fighting against COVID. Let's get back to wearing of mask when we are in public places. We can't keep our country under lockdown. We must allow normal activity to continue. Hence, we must continue to maintain our we must be extra cautious when we are out in the public. We should maintain good respiratory etiquette, wear a mask when we are out, and keep your physical distancing. With this, I thank you.
And our thanks to Dr. Ahmed. Again, 1 new confirmed case here in Dominica, and that takes our total to 19 confirmed cases. Like Dr. Ahmed mentioned, the gentleman was asymptomatic, so that just goes to show how important it is for us to continue to practice all the health and safety measures that have been promoted by the Ministry of Health, Wellness and New Health Investment. And next up this evening, we welcome the coordinator for the reopening of Borders program, Dr. Laura Esprit.
To the Minister of Health, Dr. Irving McIntyre, our Minister for Health, Wellness and New Health Investment, Permanent Secretary in the Ministry of Health, Mrs. Letitia Lestrade-Wyke, Permanent Secretary in the Ministry of Tourism, Ms. Lisa Valmore, our National Epidemiologist, Dr. Ahmed, the Officer in Charge of the Office of the Director of Primary Healthcare Services, Dr. Nesty, our Senior Environmental Health Officer, Mrs. John, and the Head of the CID, Superintendent Valerie, the media, public, good evening all. These are the updated protocols approved by the Cabinet as of today, August 20th, 2020, and this would apply to all travelers, both nationals and non-nationals. As mentioned previously, a risk classification system has been sort of modified based on the WHO, PAHO, Center for Disease Control and Prevention, that's CDC, as well as the Caribbean Public Health Agency, or CAFA models. Several parameters were therefore taken into consideration, all in an effort to classify countries and territories into 4 groupings, for which the protocols will vary. The country risk classification is expected to be reviewed on a weekly basis, but the standard grouping is as follows. 1, a CARICOM travel bubble. 2, low-risk countries. 3, medium-risk countries. And 4, high-risk countries. So this is as per country risk classification. Now, travelers from within any classification category must have traveled directly from the country of origin and have been in that country for at least 21 days prior to arrival. All in-transit countries will also influence the risk classification. Allow me to explain. Bearing in mind that most times there is at least one in-transit stop before arrival into the Commonwealth of Dominica, in order for this process to be less confusing to you, I recommend three things. 1, note your place of origin. 2, note your in-transit ports. And 3, only focus on where these countries fit within the risk classification and what specific protocols apply. Now, if your protocols differ, as a guide, you are to follow the one that falls within the highest risk or the highest spectrum. So an example, I'm hoping to travel to Dominica from the USA, which is deemed high risk based on the specified criteria. But I must in transit through Antigua, which is considered to be in the CARICOM travel bubble, hence a different classification for the two. As a result, I must be guided by the protocols for the country with the highest risk. In that case, that of the USA in this instant. So let's take them one at a time. The first one, the protocol for countries within the CARICOM travel bubble. Please note that not all CARICOM countries are enlisted within the CARICOM travel bubble for Dominica. Hence, please be guided by the published list of countries for the Commonwealth of Dominica. The pre-arrival process mandates that the traveler only completes an online health questionnaire at least 24 hours prior to arrival in Dominica. And the website, you should know by now, it's domcovid19.dominica.gov.dm. Upon disembarkation, the traveler is expected to do the following. 1, sanitize their hands at the sanitization stations provided. 2, undergo a health assessment to include a temperature check. 3, undertake a rapid diagnostic test and await results, and this may take up to 20 minutes. 4, providing that your rapid test is negative, your result is negative, the online health risk assessment is acceptable, and the traveler has a normal temperature upon arrival, then the traveler is expected to advance to Immigration and Customs for processing. Upon clearance from the port, travelers from the CARICOM travel bubble will be subjected to what we call scheduled and unscheduled checks by the medical team. So that takes care of the CARICOM travel bubble. We advance another step or another classification that will be protocol for countries deemed low risk. Unlike the CARICOM travel bubble, the pre-arrival process mandates that in addition to completing the online health questionnaire prior to getting to Dominica, a negative PCR test result recorded within 24 to 72 hours prior to arrival in Dominica must be uploaded onto the online platform. As a result of this action, a notification of health clearance to travel will be issued, for which travelers are expected to present this notification to airlines prior to boarding and upon disembarkation into Dominica. Again, upon disembarkation, the traveler is expected to carry out the following. The same sanitization process applies, undergoing a health assessment to include a temperature check, but very importantly, provide confirmation of the health questionnaire and submit a hard copy of the negative PCR test result. In addition, the traveler is expected to undertake a rapid diagnostic test and await results up to 20 minutes. Providing that this rapid test result is negative, the online health risk assessment, which you would have done before, was acceptable, and your temperature upon arrival is normal, then the traveler is expected to advance to Immigration and Customs for processing. Upon clearance from the port, travelers from low-risk countries will be monitored for 7 days, and of course will be subjected to scheduled and unscheduled checks by our medical teams. we advance a bit further. Travel protocols for medium-risk countries. So the same requirements for the pre-arrival process for low and medium countries would apply, in that two critical components are needed. First one would be your completion of the online health questionnaire, and two, uploading a negative PCR test result recorded within 24 to 72 hours prior to arrival. Of course, your notification of the health clearance will be presented to the airlines, as well as the submission of a hard copy of the negative PCR test result upon arriving into Dominica. All disembarkation protocols will apply, including submission and revision of your hard copy of your PCR test result. And this is a means to ensure that it meets the necessary standards. Moreover, providing that the PCR and the rapid test are both negative, that your online health risk assessment is acceptable, that the traveler has a normal temperature upon arrival and is not ill-looking, then the traveler will proceed to the Immigration and Customs Department for processing. Upon clearance from the port, travelers from medium-risk countries will be monitored, this time for 14 days, where at their place of residence, and they will be subjected to scheduled and unscheduled checks by the medical teams. The difference, though, is that as an option to the 14-day monitoring, a traveler can decide to have a PCR test done on day 5, whilst being monitored at their place of residence. If the result is negative, there will be no further monitoring at their place of residence. The last category would be protocols for travelers from high-risk countries. The same requirements for the pre-arrival process for low, medium, and high countries would apply, in that two critical components are needed. Again, just to emphasize, it would be completion of the online health questionnaire, and two, uploading a negative PCR test result recording within 24 to 72 hours prior to arrival. Again, your notification of the health clearance will be presented to the airlines, as well as the submission of a hard copy of the negative PCR test result upon arrival into Dominica. Upon arrival from the high-risk countries, disembarkation guidelines will apply and will include revision of the hard copy of your PCR test result whilst being subjected to a rapid test. Now, if your rapid test is positive, a PCR test will be administered immediately by means of swabbing, and the traveler will await results in a government-approved facility at the traveler's expense. If the test is negative, the traveler will be transported to a mandatory quarantine at the government-operated quarantine facility or the government-certified private property for 5 to 7 days. Why 5 to 7 days? This will allow for a PCR to be done on day 5, again at the traveler's expense, to await test results up to an additional 48 hours. Again, if this PCR is positive, hospital admission is mandated, but if same is read as negative, that's the one that's done on day 5, then the travel will be deemed medically cleared and will be subjected to scheduled and unscheduled checks by the health team. As a rule of thumb, it is expected that the aforementioned guidelines there might be some deviation if they apply. So, for example, if the PCR is positive, if your rapid test result is positive, if the online health risk assessment is deemed unacceptable or concerning, if the traveler has an elevated temperature upon arrival, or if the traveler appears to be ill-looking, then the traveler will proceed to secondary screening for swabbing, which is the actual PCR testing, and therefore will be transported to the mandatory quarantine area at the traveler's expense, of course awaiting PCR test results, which will be provided in approximately 48 hours. Clearly, there are two results. One is if the PCR is positive, then the person will be admitted to the COVID isolation unit until released by an authorized health professional. And if the test result is negative, then two things further apply. If you are asymptomatic or have no symptoms, then you will be monitored for the remainder of the 14 days at your place of residence and be subjected to scheduled and unscheduled checks by the medical teams. However, if you may have some symptoms with a PCR that's negative, you'll be encouraged to be placed on self-quarantine for 3 days at your place of residence, after which you'll be monitored for the remainder of the 14-day period and be subjected to scheduled and unscheduled checks by our medical team. So this will end the protocols based on the risk classification. Some other areas of emphasis as it relates to testing of children. For the most part, it is recommended that children under the age of 5 years will not be subject to testing. However, two exceptions exist. One, the children of families with positive cases of COVID-19, and of course, two, if they are unaccompanied. So these two groupings will be tested. As it relates to fee structure, that's also another very important component. For ease of reference, the billing structure for travelers admitted to the government-operated quarantine facility is as follows, with the exceptions that same will be paid up, with the expectations that same will be paid upon arrival at the facility. So because you are at the government-operated facility, that means you would have been swabbed for PCR testing. The cost of the PCR test is $100 EC or 40 US dollars. The fees for quarantine, which applies to the very first night, and that's for accommodation and sanitization, that would cost $400 EC or 150 US dollars per person. Again, this is for the first night. Any additional night, that would cost 225 EC dollars or 90 US dollars, and that's just for accommodation. But the rates for meals will be as follows: 15 EC dollars or 6 US dollars for breakfast, 20 EC dollars or 8 US dollars for lunch, and 20 EC dollars or 8 US dollars for dinner. As it relates to penalties, the following penalties have been approved. The penalty for non-adherence to mandatory quarantine in the Commonwealth of Dominica is 5,000 EC dollars or 6 months imprisonment. And the penalty for providing false information on your health questionnaire would be 1,000 EC dollars or 3 months imprisonment. Last but not least, let me encourage you, the public, to remain in a state of vigilance. Travelers and the public alike are encouraged to adhere to the public health and social guidelines previously reiterated, and these include, of course, wearing of your face mask at all times, even during the arrival process, up to departure, as well as in public places. Additionally, observance of physical distancing is important, practicing good respiratory etiquette and personal sanitization, and of course, following the instructions provided by your health teams and the Ministry of Health by extension. So, prevention is indeed better than cure. Let's continue to do all we can and to do what is necessary to stand a chance at confronting this COVID pandemic. Thank you.
And again, our thanks to Dr. Laura Esprey, who is the coordinator for the Reopening of Borders program, and she and her team are tasked with the very big challenge of ensuring that all the proper protocols are established and enforced. Our next presenter for this evening is Senior Environmental Health Officer Isabella John.
Minister of Health, Wellness and New Health Investment, Honorable Dr. Irving McIntyre, Permanent Secretary in the Ministry of Health, Mrs. Letitia Lestrade Wyke, the National Epidemiologist, Dr. Shaluaddin Ahmed, Permanent Secretary in the Ministry of Tourism, Lisa Valmore, the Coordinator for the Reopening of Borders, Dr. Laura Esprit, Officer in charge of the Office of Director of Primary Healthcare Services, Dr. Gilda Nesty, Head of the Criminal Investigation Department, Superintendent Davidson Valerie, the media, and the general public, good evening. Environmental health officers continue to carry out port health duties at ports of entry to ensure that all passengers disembarking are in compliance with the protocols developed for reopening of borders. And presently, there are 8 environmental health officers providing port health services at Douglas Charles Airport. A typical day at the airport starts off with the port health officer carrying out inspections at the facility to ensure, as far as practicable, that the airport is maintained in a sanitary condition. And that is to ensure that all the waste that is generated must be collected and stored properly, to ensure that all sanitary facilities are clean and functional, hand washing sinks are functional, hand sanitizing and soap dispensers are filled and functional. The officer is responsible for boarding all aircrafts to receive the General Declaration of Health and to ensure that the aircraft is in compliance with health requirements, and also to grant free pratic. That means they give permission to allow the passengers to disembark. While passengers are disembarking, the port health officer monitors all passengers to make certain that they are wearing masks, which is a requirement when you are disembarking the aircraft, and to observe for any signs of illness. At the COVID screening facility, all passengers are required to sanitize their hands before proceeding to have their temperature checks done by the port health officer. And according to the protocols, if the passengers do not present a temperature greater than 99.8 degrees Fahrenheit, they are then directed to proceed to document validation. At document validation, they will present to the port health officers a hard copy of the approval letter, giving them clearance to travel to Dominica, and that they would have received after they have filled the online questionnaire. They are also required to present to the port health officer a hard copy of their PCR test results done within the specified requirements before travel for the passengers that are required to do this test according to protocol. If all the documents that are presented to the port health officer is valid, they are then allowed to proceed to the primary screening area to have a rapid test done, or if not, if these documents presented are invalid, they will proceed to secondary screening. So far, many of the persons who have come through Douglas Charles Airport have been cooperative with the officers, and for that we say thank you very much. Preventing the spread of COVID-19 or any communicable disease has never been and cannot be through the efforts of the policy makers who establish the protocols or the healthcare providers providing the healthcare services, but it is a collective approach by us, the general public, the nationals and residents looking forward to returning home, or the visitor who wants to enjoy what the Nature Isle has to offer. We need to take ownership and responsibility for our health make the right choices to safeguard ourselves, our family, our friends, our neighbors, and most of all, our country. Please continue to follow the protocols that are set by the Ministry of Health. Practice hand hygiene, wear your mask, practice social distancing and respiratory etiquette at all times. COVID-19 protocols have been established for food establishments, hair salons, gyms, spas, gaming shops, daycares, and churches, and we expect all to follow these protocols as you will be subjected to inspections by the Environmental Health Department. Training has also been done in collaboration with the Discover Dominica Authority for car rentals, taxi operators, both at Douglas Charles Airport and at the ferry terminal, for tour guides, hotel operators, and park wardens. And we expect that all the guidelines that were given to you in this training are adhered to. Thank you very much to all the frontline workers who are present at the port of entries every day. But most of all, thank you to the team of the environmental health officers who are always there to respond, ensuring that the protocols are adhered to. Thank you very much.
And thank you very much, Isabella John, who is the Senior Environmental Health Officer. Our next presenter this evening will be Dr. Gilda Nesty, and she's the officer in charge of the Office of the Director of Primary Healthcare Services. And she now leads the team responsible for the monitoring of those who are on home quarantine. And she'll also speak to us about the protocol for those who wish to leave Dominica. Dr. Gilda Nesty.
Minister of Health, Wellness, and New Health Investment, Dr. the Honorable Irvin McIntyre. Permanent Secretary in the Ministry of Health, Wellness, and New Health Investment, Ms. Letitia Lestrade-Wyke. PS in the Ministry of Tourism, Ms. Lisa Valmond. Coordinator of the Reopening of Borders, Dr. Laura Esprit. Mistress Isabella John, Senior Environmental Health Officer. And Dr. Shaludin Ahmed, National Epidemiologist. Good evening. Good evening also to my fellow Dominicans. I am here in the capacity, as mentioned before, as the officer in charge of the primary healthcare services. It is indeed a privilege to address you today on two topics that are of utmost importance, namely home quarantine and pre-travel screening. Primary healthcare continues to be integral in the management and control of the dreaded SARS COVID-19 pandemic in Dominica. After completing primary or secondary screening and after being given days of quarantine period required, the traveler is escorted to their home or quarantine address. From the time the traveler leaves, he or she is advised to go directly to his or her designated address. On arrival home or at their quarantine address, the traveler is expected to sanitize and isolate themselves from other members of their family or members of their household. If they must interact with family members, they are expected to wear their mask at all times. Travelers must undergo and document their daily temperature checks. Having a handheld thermometer at home is therefore recommended. All travelers will be contacted by the district health team in the area that they reside. They will be contacted by phone initially and will be subsequently subjected to scheduled and unscheduled home visits. After successfully completing the set days of home quarantine, The traveler will be discharged from further follow-ups by the district team. Travelers are also encouraged to monitor themselves closely for the development of any signs or symptoms of SARS-CoV-19. These include, but are not limited to, fever, sore throat, dry cough, shortness of breath, and also loss of taste and smell sensation. Should any of these symptoms arise, travelers are advised to remain home or at their quarantine address, but call the hotline immediately at 448-2151 or 611-3254. Let me further emphasize the need to maintain quarantine protocols as laid down by the Ministry of Health, Wellness, and New Health Investments. In order for us to continue to enjoy the liberties we truly cherish, our travelers' compliance with home quarantine is indeed critical. For those intending to travel out of the island, a pre-travel screening process is necessary. This includes calling the health center at 611-3905 to schedule an appointment for a PCR or nasopharyngeal test. Please note, the onus is on the traveler to find out for themselves the requirements for travel to their final destination, as well as any country for which they will be in transit. The client is then required to pick up their requisition form at the Roseau Health Center. Once the requisition form is secured, the traveler is expected to pay their fees for their PCR tests at the accounts department of the Dominica China Friendship Hospital. The traveler then returns to the health center on their scheduled date. The PCR test is administered, and the turnaround time for the test result is 48 hours. That too is still dependent on the volume of tests to be done on that specific day. The traveler therefore is expected to schedule their travel date and the available PCR testing date accordingly. Thank you for listening to me today, and I do hope that the information imparted on you at this time is clearly understood and will be taken seriously. I would like to also use the opportunity to thank all of my colleagues at the primary healthcare level, the nurses, the district officers, the cleaners, the security staff, all of the team members who work together to control this dreaded disease. Thank you very much.
Thank you very much to Dr. Gilda Nesty, the officer in charge of the Office of the Director of Primary Healthcare Services. And for the past several months, we have partnered very closely with the Commonwealth of Dominica Police Force. And it is with their assistance that we have been able to ensure that a lot of the restrictions that were in place were adhered to. And this evening, we welcome once again the head of the Criminal Investigations Department, Superintendent Davidson Valerie.
Minister of Health, Wellness, New Health Investment, Dr. Irvin McIntyre. Permanent Secretary, Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke. Permanent Secretary, Ministry of Tourism, Lisa Valmon. National Epidemiologist, Dr. Shaluddin Amid. Coordinator of the Reopening of Borders Program, Dr. Laura Esprey. Senior Environmental Health Officer, Acting, Isabella John. Officer in charge of the Office of Director of Primary Health Care Services, Dr. Gilda Nesty. Members of the media, the listening public, good evening. The Commonwealth of Dominica Police Force continues to execute its functions in minimizing any possibility of the spread of COVID-19 in Dominica. We have been relentless in our border patrols, both on sea and on land, to prevent or intercept persons who seek to enter Dominica illegally. To this end, I can report that 6 vessels have been intercepted and 25 persons were taken into custody and dealt with. All of the persons who have been taken into custody were quarantined. While citizens and visitors are allowed to enter Dominica and welcome to Dominica, they must adhere to the protocols in place for anyone entering Dominica. No one will be allowed to enter Dominica except through a legal port of entry. Consequently, I wish to warn the people involved in the illegal movement of persons in and out of Dominica that they must cease from this unlawful practice immediately. The police will utilize whatever means that are reasonable and necessary to prevent or disrupt anyone found or suspected to be engaged in the illegal entry into or departure of persons from Dominica, or anyone involved in the facilitation of illegal entry or departure from Dominica. I appeal to the general public. Please report to your nearest police station anyone or any activity involving the illegal entry of persons into Dominica or the illegal departure of persons from Dominica. The police are partnering with the Ministry of Health, Wellness, and New Health Investment and will not be permitting any public activity which is expected to generate large crowds. Persons who are being placed in isolation or quarantine under the regulation are warned to comply with the requirements in place. Anyone who absconds or attempts to abscond from isolation under surveillance or quarantine imposed under the regulation commits an offense, in which case the police have the authority to take this person into custody, to have him or her returned to a suitable specified place by the medical officer. And I'll say that again. Persons who are being placed in isolation or quarantine under the regulation are warned to comply with the requirements in place. Anyone who absconds or attempts to abscond from isolation under surveillance or quarantine imposed under the regulation commits an offense, in which case the police have the authority to take this person into custody, to have him or her returned to a suitable place specified by the medical officer. The police may use reasonable force in the execution of the function under the regulation. Finally, let us all collaborate to ensure that we protect Dominica and prevent or minimize any possible spread of COVID-19 virus in Dominica. Thank you.
And again, our sincere thanks to the Commonwealth of Dominica Police Force and to Superintendent Davidson Valerie. Ladies and gentlemen, this evening you've heard a lot of information, some of them new to you. Information including the new confirmed case here in Dominica, the CARICOM bubble, and the fines and other repercussions for those who do not adhere to the instructions of the medical team. It has not escaped us that for many of you traveling, you do face difficulties. However, we ask that you also understand that our primary responsibility remains to protect everyone here in Dominica. The protocols are not in place to make life difficult for anybody. The protocols are not in place as punishment for anybody. Nobody is being singled out when these protocols are being established. But we ask that you cooperate with us as we, of course, continue to protect the welfare of Dominicans. We remind you, as always, that there are health and safety measures that you can take to protect yourself: wearing of masks, sanitization, washing of hands, respiratory etiquette. Ladies and gentlemen, we also remind you that the hotline is available should you have questions. The numbers again, 448-2151, 448-2153, 448-2156, 611-4325, or 1-800-219. Let me urge all those of you who call the hotlines. The people working the hotlines are human. They should not be abused. They are here to assist you. The nurses and doctors at the quarantine facility as well. Please remember that they are doing their jobs. Even members of the security staff at government buildings, when they ask you to wear your masks, they're doing their jobs and they're protecting you as well. A reminder of the health questionnaire. It's available at domcovid19.dominica.gov.dm. We thank you for your patience, and as always, we thank you, the general public, for your cooperation. Have a good evening.